Right now, let me take you to Labadi. We have our Joy Thought leadership on COVID-19 safety at the workplace. Let's join that feed now.
Beach Hotel, first choice.
So with that in mind, I'd like to call on Mr. Jidel Fiavo, who is the marketing manager for New Crystal Health Services Limited, to make a quick statement, followed by Ms. Bonifacia Benefo Ajay, country manager of Safe Care Farm Access. And they will make two quick statements, and we'll go into a series of presentations, after which we'll have a discussion. And we encourage you to share your own thoughts and questions via the hashtag safety at work. That's safety at work. And we will make sure that we come to you on Zoom as well. If you have questions, there is a raise your hand button that you need to click on, and we will come to you, and you can all have your questions answered by the professionals and experts that we have here in the room. So let's welcome Mr. Jidel Fiavo. There aren't that many of us, but a round of applause will do. Good.
Thank you very much, Inshira. Good morning to our listeners and viewers on TV, radio, online. My last count on COVID-19 infection in this country as at yesterday, 21st June 2020, it was 14,007. And we are aware that this year is an election year. We are told that when humans move, the infections also move. Predictably, the infection is going to go high. We are also aware that those actively involved in the political activities are the same labor force at the workplace. It is one of the reasons why we are having this event, where we've put together a team of experts that will share with us a better understanding as in what is supposed to be at the workplace, whilst we ensure that business continuity, it is still ongoing. Our CEO, Dr. Wisdom Amableto, has put together a team of experts purposely to help organizations when it comes to the area of screening, when it comes to the area of isolation, when it comes to the area of tailor-made protocols that will ensure that there is no anything untoward. There is obvious reason why American president and the vice will not travel at the same time in the same flight. That is the purpose of this team. It is one of the few hospitals that have this team of experts, just to ensure that there is business continuity whilst adhering to protocols at our workplaces. Maybe you may ask, who is New Crystal Health Services? New Crystal Health Services is a group of hospitals in Greater Western region, specifically
And thanks for staying with us here on Newsdesk. Let's return to the Labadi Beach Hotel for the Joy Thought leadership on COVID-19 safety at the workplace.
Coronavirus is not only COVID. There were already SARS, MERS, and others. And so there are many other infections that we could be preventing if we put together a good infection prevention program to implement. I have brief outline Basically, I'm going to point you to some areas that you need to pay attention to in drawing up or in putting up infection prevention in your area. Now, before COVID, I pretty much think that most workplaces which had nothing to do with health were not even using the word infection, let alone prevention. And so it's pretty new to most people. And so we're going to take you through some of the areas that you need to pay attention to whilst going back to work. Most of you have returned back to work, how you can prevent the infection whilst you go up with your normal work duties. The other thing is also to look at, in case you have any suspected case or really a confirmed case, what are the steps or what are the things that you need to do? And then where do you find help? Before I go deep into these three outlines, I'd like to make these various statements. I think the earlier speaker had even mentioned that the novel coronavirus SARS-CoV-2 has brought about many changes in our lives. It has no respecter for persons. It doesn't mind whether you are the president or you are the least person, wherever you could get it. The other thing is that it has changed our lifestyle and drastically changed our businesses and the economy. In fact, for most to the negative side. There are also some few areas that are industries also that are also benefiting from the situation because they have taken some pragmatic and proactive measures. But what is very important is that the responsibility for ensuring that this infection doesn't really damage our economies, damage our workplaces, damage our lifestyle, lie with all of us. And here, as I'm speaking to the workplace, then I'm talking about both employers and employees. And this is very important for us to take home, that we are both responsible for ensuring that the infection doesn't cause much damage to our businesses and our livelihood. So employees and managers at their workplaces will have to help by help prevent this COVID by establishing effective workplace policies and procedures that will help us, by implementing them, will help us prevent the infection. On the side of workers, we also have to participate in the development of those policies and procedures, because whatever policies and procedures that are going to be put out for you, you are the ones that are going to use, and you are the one that is going to affect you. So you need to make inputs, also be involved, and don't just sit and say, they haven't given us this, they haven't done that. So you need to be involved in those safety measures, so safety policies that are going to happen in your workplaces. Now, in responding to these, your plans must also be up to date or have to bear the current information that goes on. So hitherto, until just about somewhere last week, we knew that if somebody were to be positive, there was going to be about 1 or 2 post-infection tests before they come home. But recently, and this is very important for all of us to appreciate, it is a new condition, it's a new virus, and we are learning of it every day. So new information comes every day. So recently we have now heard that within 10 days to 14 days of being infected, you will probably not be shedding the virus through your oral or respiratory system anymore, and so you'll be least infectious. And so things therefore change with that. So if you have certain program or plans before this information, then you need to go and look back and see how you would have to change your policies. So that's very important, that whatever policies is not fixed, it goes along with the information. So it means you have to be in tune with information that are coming on about the condition. Then there is also the need for us to follow and obtain timely, as I said, adequate information for everything. Now, because I'm speaking to infection, I want to quickly, I don't have much time, I want to quickly take us through how infection, we get infection, or what we call infection cycle. So we have what we call pathogen. They are the ones that will cause the disease. So they are those at home, or if you don't have any bearing with science, they are the germs that we know, virus, bacteria, all those ones are called pathogens. So they are the cause itself. Now, before they can cause infection, they all usually harbor themselves in something or an animal, which we call reservoir. Usually for a coronavirus, we have come to know that certain animals serve as reservoir, and then later on they move to human beings. For COVID, it is not too clear, but you also have to know that the organism can also lie on formites. When you say formites, surfaces, items, anything at all, where they will lie. Somebody mentioned that the organism, it does not have legs. It's true, it doesn't move. It is not actually, viruses are particles. They don't move unless you move them. So the items that we touch, we speak onto, we cough onto, they become the reservoir for a while before we carry them to ourselves. Then we have the portal of exit. How do they come out of the reservoir or the host? Is through our respiratory system or airways for simplicity. We also have the mode of transmission. How do does the condition affect one person from one person to the other? I think we all by now are very much aware, by the way you have covered your faces, that it comes through the airway system or the respiratory system, and it comes through respiratory droplets. Now, as I'm speaking, if it hadn't been for this mask, there is the likelihood that there will be some small droplet from my mouth. And even when I breathe, because I'm speaking under some form of excitement, but when I cough, that projection goes further, and it even increases when I sneeze. And when you sneeze or cough, they all carry a certain number of the microorganism, which is the virus, in that small droplet. Now, the more infectious you are, the more, of course, you'll be shedding. And so that is why we need to cover our faces. Then, of course, the way the organism will move, exit to the other, is also there. We also have how the organism would exit from the person's system, still also the oral cavity. So this is the simple cycle that you would want to look at. Now, objective of any infection prevention program that you would host in your workplace, whether it is a hospital or it is a transportation agency or it is a school, whatever it is, the objective is to make staff adhere to the various measures that are required to prevent the infection. The next one is to let the staff recognize the symptoms of the condition, the coronavirus, so that when somebody is manifesting it, it will be quickly picked by them and then they will follow protocol. The next thing is to identify and report any possible risk of infection as early as possible, and then ensure the promotion of safe workplace. So these could be 4 key objectives. Of course, this is not exhaustive. You could add on more and more. Now, what do we have to do? So I started by explaining that we both have roles to play as employers and then employees. Now, what do employers have to do, employers and managers? The first thing is that we need to establish infection control strategies based on thorough assessment of our employees and the possible exposure based on the work they do. So there is the need for every employer and actually every workforce to take a quick look at their workplace and see how could they be exposed. So I have just told you about the mode of transmission, how it transfers from one person to the other. So obviously we all know that person to person, closer contact as we have known, touching surfaces or high touch areas are some of the means. And so depending on where you're working, if you are, say, a banker, then we know that you are exposed to many people, probably not less than 40 people in a day at a time. And all these people could be potential carriers of the condition. So how then do you change or redesign the banker's environment, or say the teller's environment, so that it becomes protective to the employee? So this is something that every employer and employee have to go through. As soon as you return back to your full session of work, let's go through it and see where is it possible that we could have the infection. Another way to review it is that your environment, work environment. So somebody has been cleaning the surfaces, because it's possible that those of us who have been standing here will be touching, and we could be carrying it on our hands. So reviewing the surfaces that need to be touched and saying that we are going to clean it, say, every hour is also a form of strategy that you need to adapt. So these are things, examples of some of the things when I say establish a strategy that you use to control the infection. Then, of course, you have to deploy the appropriate mechanisms of doing so. So if we say cleaning the surface, what is the plausible or possible number of times that it can be done? And how effective can it be done? What do we need to do those cleaning? What do we need to screen the banker or the teller? What do we need for the one who goes for marketing outside and go and talk to people? So these are things that you need to look at. What are the mechanisms? What are the processes? And then what are the materials that will be required? So that's the next stage, which also need to be thought through by managers and then the staff as well. The next thing is that you classify your risk. So based on your risk, remember you are using resources. So who comes closer to, or whose exposure is higher? If I am a frontline health worker who sees clients the first time they come, I'm the first person to contact them, my exposure is higher than a health worker who is an accountant who sits in the office. So we need to be able to evaluate that and be able to deploy our resources, because it involves budgets. So you need to be able to do that and deploy your resources adequately, else in no time you say that COVID has broken you down and you can't work again. So that's also very important. That's why you need to classify your workers' exposure. The next thing is that having done that, having had your plan and identify your risk areas and so on, we need to have a proper training program for staff. Now, it is amazing. Before the lockdown, I conducted a short training. My country director asked me to conduct a short training, practical training of hand washing in our office. And it was amazing how people didn't know how to wash hands. And people have been washing their hands and eating in the office. I see them every time. But they were now saying, oh, that is why my hands are like this. So when you wash it continuously for 40 seconds, it's different from just washing your hands under the water and turning like that. And that will not help. So don't underestimate these training, which you might think it's easy. You might think about people should know how to wash their hands. But it is not that simple. And so hand washing, I recall somebody called me and said, I never knew there was a formula for hand washing. So hand washing is even a training. How to wear mask. I have been troubled mostly when I walk through town, how people use the mask, how people touch their face when they are wearing the mask, how people turn it upside down, how people wear it like this, and when they are talking, rather, they remove and talk. All that are part of it. And these people we see are the same people who are from the workforce. And so they are in your workplaces. So you need to actually have training program for them, how to use the PPE, how to wash their hands. The people that clean, they are now very important to you. Those who clean your offices, you barely see them. Some of you have never seen them before. But now you have to be seeing them, because they don't clean only once and go. They have to be available to be cleaning every hour. In my office, every hour we have identified the high-touch areas like doorknobs, switches, fridge doors. These are all high-touch areas, high-contact areas that have to be identified for them to be sanitized hourly. So those require training. So we need to train people, and even giving information on the condition is also a form of training. So training is very, very important. I would recommend that during this time, every workplace would have, at least within every week, minimum every 2 weeks, will have about 30-minute session where they discuss the condition and how things are going. Very, very important for all of us, the information. Then we also have to commit some budget to it. I've already indicated that. I will just run through this. We know all these standard precautions: hand hygiene, hand washing, I've already spoken about it. Respiratory hygiene, as in the etiquette of covering your mouth with tissue, or at least if you don't have a tissue, with your elbow when you are coughing. We also have to keep our distance, as we have been doing, and it has to be implemented in the workplaces and enforced. So workplaces, friends who have been seated together for a long time, now you separated them. It takes a while for them to remember that you don't have to go and sit and go and speak into the ears of people, stand by their desk anymore. So there must be somebody, or a task force or a team that really goes on and monitor that in the workplaces, so that we ensure that the protocols are being observed. We are human beings. We've lived as a community, we've lived close to each other for a long time. Suddenly, we are now separating. It's not easy. They will forget. So a constant reminder through posters, a constant reminder through announcements, a constant reminder through morning meetings are some of the things that you can do. Of course, wearing of face mask now, it's mandatory or by law, so we need to wear them. And not just wearing, but wear them appropriately. So the team that is in your office to ensure that must know how mask must be worn, and it must be worn continuously by all people. The one most important thing is your general sanitation in your workplace, your washrooms. We are now saying that after 14 days, people are no longer infectious through the oral cavity or the airway passage, but it's possible that people could shed it through other means. And so those other means too, we need to protect us by disinfecting, decontaminating the washrooms very, very well, and everybody knowing how to use it very well, so that nobody gets in contact with the other person's something. So this is also very, very important for us to look at. There are other actions that we also have to pay attention to. We need to conduct a daily checks, and the daily check simply is checking people before they come to work. So in Farm Access, if those of you have visited us recently, we also have a thermometer at the junction, and any staff who is flagged above 37.5 is sent home to go and work from home. About 2 weeks ago, somehow, I developed some fever that I couldn't control. I was stuck at 37.9, and I was not going down. So I kept on monitoring till I got to 37.5 before I left. So this is very important. Don't underestimate it, because it could be something or it could be nothing. But we need to manage them. So daily monitoring of staff. And then if a staff is otherwise showing other symptoms, not temperature, but coughing, people have to be sensitized. to take the responsibility to report and leave, but also others have to monitor other staff to ensure that they don't stay on when they are showing any symptoms. Then we also encourage employees to wear their PPEs. Aside the mask, people who are working at other areas who are into contact with, there could be healthcare workers, there could be healthcare-related workers, there could be people who also deal directly with monies, and those people must also be wearing protective clothing like gloves if they have to count a lot of money and all that. So ensuring that and monitoring that staff are using them appropriately is very important. Improve ventilation in offices. If it is possible, these days the rains are down, so the weather is a bit cool. If it's possible, let's use the windows, let there be true ventilation, let there be sun rays, so that the ultraviolet light too can do some magic for us, help us to take some of the infection away. And I also will put here that we have to actively encourage staff who are sick to not to come to the office. They have a relative who they are living with who has also been tested positive or have been put on quarantine, then they have to share that information and therefore stay at home. They don't have to come. And so arrangement has to be in place for all that formal arrangement. So if the work is such that the person can work from home, then we make arrangements so that work can go on, or at least some level of work can go on whilst they stay at home. Then designate a COVID-19 task force. If your outfit of your company as at yet doesn't have anybody designated to be monitoring COVID-19 activities, it is time for you to do that. Depending on the size of the organization, it could be one person or a team that is designated with specific responsibilities to handle under that. Establish reporting system. So we need to be clear, if we find somebody who is showing some suspected signs, who do we report to and how do we escalate that to the next level? It's very important that it is clear and everybody should be aware of it and should be familiar with it so that its implementation will be seamless in the organization, that we don't have to say the director is not available, so I have to stay on with my illness till he comes. So it's very, very important that we make that protocol also very clear to all our staff members. Now, in case of infection, I believe Ghana has a number of numbers, the national numbers that you could call and indicate, but the first step is that the person has to self-isolate, go home and self-isolate, and then of course we have to report it. Now, one of the important things that has to take place in the organization every day, every time, is records of all people who report to work, records of all people who report to work, because when there is an infection, we need to take stock of all the people who are around so that we'll be able to do proper contact tracing and then do the testing. So that is also very important. And so that is the first thing. The next is also to report it to the national system. Ensure complete headcount. I've already talked about it. Now, if possible, the employee should also make, the employer should make arrangements with a psychologist or a seasoned counselor to also counsel the staff, those who have it and those even who don't have it. As soon as there is a record of infection, there is panic in the system, and that can lead to a lot of things, including lower productivity. So if you have a connection with a psychologist who can talk to people, who can give regular counseling to people, that is very, very recommended. Services such as the UGMC COVID Connect is available, where you can also let your employees log on and get access to care and support, also available. Now, please note that what we have talked about is not exhaustive. It's not comprehensive yet, but it is only an outline of what you can put in place. And every employer must roll out their own policies and train their staff on them depending on the environment and what they do. And when we do that, we have a clear plan and we monitor adherence of it. I believe that we'll be able to curb the infection until such time that we have treatment or vaccine or we have been able to eradicate that. Thank you very much.
Thank you very much, Bonifacia, for that presentation. And without wasting any more time, I'd like to call on our next presenter, and that person is in okay, so it's Dr. Alote Ado, and he's going to be speaking on the workplace safety and business continuity. Let's welcome him, please.
Thank you very much, Insha. Good morning to our viewers and listeners on radio, on TV, and online. Okay, so I did not belabor the point. We're not in normal times, so it's important that we get to learn to adjust to the conditions in which we find ourselves in. Business and the country as a whole, indeed throughout the world, has been affected badly by the current pandemic. Economies literally are at a standstill. Our various businesses are also at a standstill. It's important that we get back to work, especially now that we have come to know that we need to live with the virus. So how do we live with the virus and yet continue to do what we do and keep our employees, our offices, our workplaces, and various businesses very safe? Now, Bonifacia literally talked about most of the issues. However, from a health and safety perspective, I'd like to share with you, especially because we do not have enough time on our hands. Subsequent to this, if anybody was interested, you could contact the New Crystal Healthcare Limited team. You could contact from Access, they will direct you to us as well. We will share with you subsequently our contact details. And then you can contact us. We could come to your premises and help you out on that. Now, so how do you keep your workplace safe and your employees also very safe? Just a sec. Okay, great. Now, when this thing started, what has been the goal as a country towards this pandemic? We said we're going to do what? We're going to test people. We're going to survey to make sure that we pick people out, get them out, isolate them, treat them if we have to treat them. As a result, we kept in the various measures, went into lockdown, now had to ease the lockdown and get into back to business. But what's the idea behind, or if you like, the objective behind getting our workplace safe? We want to make sure that as much as possible we're able to prevent the infection. We want to make sure that if we're not able to prevent, we can at least reduce the rate of transmission. We want to make sure that we want to take out fear, which has engulfed all of us, and panic. We want to make sure that we are mitigating or we are limiting stigmatization if we can avoid it. And ultimately, we want to make sure that we're keeping everybody and the environment safe. So you want to make sure that the people that you interact with, your partners that you do business with, the customers that visit your facility, are assured that when they get there, they are safe and they can interact with you. So what are the key things that we need for this pandemic? As we all know by now, hand washing, which is, if you like, enhanced hygiene, face masks, just as we all have it, social distancing, and indeed, for a nation, contact tracing and testing. Now, for a business, what do you really need to do to keep your place safe? You've got to be able to plan. You've got to be able to prepare. You've got to be able to respond. So I leave all of us with these three key principles. We plan, we prepare, and then we respond. So there's no one size fits all, but the general principles of infection prevention, just like Boniface has elucidated a few minutes ago, it holds for everybody. But the various businesses are different. It's important that we all understand. So as part of your planning purposes, what do you need? You need to determine what your business entails. Are you into manufacturing? Are you into healthcare? Do you run a small shop? Are you a hotelier like we are here now? Because the kinds of things that you may have to do will vary a little bit. Are you a place that have high traffic? So you have a lot of people moving through and through. So for example, on Sunday, I went to a certain manufacturing company and they said to me that, "Doctor, we have a problem with social distance." Why? Because their staff strength is high, and you have a lot of visitors also coming in. I mean, that person's, if you like, that person's strategy would not be the same as a small business strategy. So it's important that you determine what business that you find yourself in. Once you identify the business that you find in, then you need to determine what are the kinds of things that I need. Some of which benefits I've said that. Because when you determine the business, that also determines the kinds of things that you need to acquire in terms of investments that you will have to put into getting your place safe. Okay? So you also need to determine what kinds of, if you will, cleaning materials or disinfecting materials that I need, because we're talking about prevention of infection here. We're talking about prevention of COVID-19. So you also need, just like what if you also need to educate your staff. It's extremely very important. Educate them on the signs and symptoms of COVID. And this has to be reinforced over and over and over again. And it is important that you don't take things for granted. So somebody has a fever, okay, you might as well stay at home or potentially talk to your doctor. I will also recommend at this stage that it is important that every business at this stage should have a go-to, if you like, medical advisor, because it becomes extremely very important. Because when your employee says to you that, "Oh, I have a running nose," how are you able to tell? Because of COVID-19, you say, "Okay, stay at home, don't come." But for all you care, it doesn't have COVID-19. And these are the things, some of the things that can also reduce your productivity as well. So that's an advice I want to share with you. So once you have these, you educate your staff, and they have this knowledge, and you've put in all the necessary things, you've assessed your company, you've determined what kinds of things that you need, and then you also want to consider what do you need to keep the environment safe. Once you have all of these things, that you want to now implement your plan, okay? And in implementing your plan, there are various things that you would need to implement in plan. So as part of it one of it will be the education. So when you education, you need to have things like infographics. You need to display pictures that speaks to people, that people will understand, that people would appreciate and identify with. Okay. Then you need to also have just like a flexible work regime. So somebody has a cough and a fever. You don't want that person showing up at work because you cannot determine whether the person has work. So it's important that we have plans in place to have flexible working hours, especially for companies who can afford to do that. It's important that we're also looking at those of us who run shifts. We'll look at the shift. Even if you don't run shifts, is it possible that you can look at the shift system now? If you run shift as well, so for example, in a healthcare where we run 3 shifts, can you do a 2 shift now, which now reduces the number of people that get exposed at a particular point in time, all right? Now, Boniface mentioned something, the cleaner. We haven't respected the cleaners up to now, but indeed, The cleaners are one of the most important personnel in every organization, because if the cleaner didn't clean here this morning, none of us would have been sitting here to do that. But the cleaners become extremely very important. So it's important that you're clothing them very well, i.e. PPEs, because they're the very people who would clean all of these things that we are doing, okay, that we are touching, that we're holding, that we're sneezing and leaving them on the floor, the tissues and the other people. So it's important that we clean them very well, because they become extremely very high risk for exposure. So those are some of the things that you would need to, and you need, once you identify that, you need to do, like Boniface said, regular, constant. Again, you've got to be able to distinguish. So I'll share with you a list of a few things that, if you like, that are highly used and touched. But if you just mention a few of them, like your door handles and knobs, the PCs that people use at work, and tables and chairs as well, especially in healthcare facilities where we're seeing lots of clients. It's important that you're having people to be able to clean these things at extremely very regular intervals, the temperature guns and all of those things as well. And then you regularly communicate with your clients and your staff. Okay, you've got to be able to update them regularly on what the current, because this is changing. It's extremely very fluid. We're getting new information literally on a daily basis. So it's important that you're keeping employees well informed, well updated to what is happening and the current trends. It is only by doing this that you would help and they would appreciate and understand and come on board for all of us to help prevent the COVID-19 and to keep your place very safe. All right. Now, as a business, it's important that when you look at all of this, you also need to look at what the business entails. So when you're having meetings and conferences, how you, just like we have now, what your setup would be like. Do you want to travel? Is it an important travel? If it is not an important travel, you can make use of technology. Indeed, we need to make use of technology, just like we are doing now. So again, that we can minimize and keep people extremely very free. So we need to make use of technology. Okay. Then very quickly, like I said, indicated earlier, I said I'd share with you a list of a few things. So you have your doorknob tables, and tables, light switches, countertop handles, decks, phones that we all use. If you like, toilet seats, faucet, sink, gas pumps. So if you go to buy fuel, for example, touch screens, ATM machines that we all use very regularly. These lists are completely not exhaustive. But once you look at it, you can imagine and understand the places and if you like, the gadgets and objects that we touch very frequently and what we come into contact with. Once you do all of these will ensure that your environment and your business place is safe. Because when you have lost as business people, when employees are not able to come to work, they are not able to produce whatever they are supposed to produce, they're not able to meet whatever target you've given them, that then affects your bottom line. And this is not something that every business person or every businessman want to have in an organization after what we have been through already. If you're able to do a lot of these things together, and what we do is that we ensure that we keep the environment very safe and prevent, there's a lot of information available. I encourage you, if you can go to the WHO website, which has a lot of information, the CDC website, which is Center for Disease Control in the US, which also has tons of information. And of course, our own Ghana Health Services also have tons of information. We don't have too much time. I will pause and here. Once we have the question and interaction time, we will have a lot of questions and then we can go into extreme very details. Thank you very much.
Thank you very much,
Dr. Alote Ado for that presentation. We're going to go into our final presentation just before we start the next round of discussions, which would be the panel discussion. And this presentation is around raising employee enthusiasm and confidence for maximum productivity, and it will be presented by Dr. Philip Anderson, the country manager for Roche Pharmaceuticals. Let's welcome him, please.
Good morning, everyone, and good morning to those on Zoom and on television. Right, so I think we've heard a lot about occupational health, safety, putting the workplace and the environment in readiness for work as we open up work and schools and all. But if you are talking about work, then we are talking about business. We are talking about top line, bottom line, employee motivation, and how you can still, in the midst of all these, get the best out of your team. We would understand as business people that everything about business begins with leadership, right? And so this is the time that all organizations, I say, would need to reimagine leadership. The fact is that businesses will not reopen the same way it closed before COVID. People will not come to the office the same they left before COVID. And particularly important in all these setups is the kind of organizational leadership, culture, and structure that you have. We have heard about things like VUCA, environments in the world, and I think this is what exemplifies it the most. I mean, we living in low and middle income countries and emerging markets are quite conversant with a certain level of it, but this was global in nature, affected everybody and every business. I think as of January, most of us had ticket bought, meetings planned, conferences in the course of the year, and by March, we had forgotten everything. Now, what is it that will make a leader responsive to some of these things and these changes? And the first I put on this is leaders who embrace uncertainty. You cannot tell at this moment, as a business leader, how much inventory you should hold. You cannot tell now as a business leader how much investment you should make into telecommunication and digital channels, because you don't know what is going to happen next. You cannot tell as a business leader what kind of staff strength you should hold and even what skills that you should have in your organization. If you're a business leader who in the past would only make decisions following concrete information, absolute information, then I'm sorry, you might need to reimagine the way you lead your organizations. The second thing is about hierarchy. I think globally we were beginning to realize that organizations that thrive on hierarchy and command and control kind of leadership were beginning to suffer. And this is because now employees require transparency. They require a leader who sits and speaks with them and knows where things are going. And so if you've thrived on hierarchy to establish a structure, then it's about time leaders and organizations begin to look at the changes that are happening here. Employees more and more need to be given autonomy and trusted to do the work. Because if your staff, they're working from home and not from the open office or the office where you see them and clocking when they come to work or when they go home and all that, it's about the trust and the autonomy, believing that the staff will do the right thing. The next thing we would want to talk about, which fortunately Alex and Bonifacia have spoken quite a lot about, is about the workspace. And I talk about tailored changes at the workspace. And this is what brings out the trust that your employees would have in you. I have on the screen a graph, for instance, that showed, and this is as at April 16th, 2020. These are the top things that led to mortalities in COVID
in Italy. And the highest being hypertension, diabetes, heart diseases and all. Now, if you follow the Ghana Health Service website and then the background of the people who died, we have kind of a mirror image of what is happening around the world. Now, the question is, what do you do with such employees in your organization? When do they come back to work? What kind of work do you expose them to? Because doing this for them builds their, I mean, they know you care about them, and they know you are taking practical steps to protect them. Who is that employee who lives with a mother or a grandfather or a husband who has some of these comorbidities? And what are you doing practically to ensure that this employee is also kept safe? Again, we talk about roles and tasks, and I think they spoke quite brilliantly about it. Who is fit to do what? And this is based on the level of exposure that an employee has with people and with the number of people and the kind of work that they do. I think it's about time, as we talk about this, where we talk about things like the antibody testing, for instance. We know people mount some form of protection when they are exposed to COVID. Now, for instance, if you're in the healthcare industry, as New Crystal is, who are the people that you think you feel more comfortable about to put on the front line? Are they people who form some IgG following exposure to COVID? If you run a corporate antibody test and you see people who have IgM, mounting antibodies, which mean that they are still probably in the face of the disease, it's a good opportunity to take these people out and test them properly and treat them. And this is what we talk about, tailored workplace environment. And so as much as we talk about the infrastructural and the hardware things to make the office ready, we should again talk about the individuals and what will make them have the trust that the company is doing much to protect them. I think more and more we need to embrace what we call the work-life balance. And you mentioned it about the need for psychological support for employees. Some have had very close shave with COVID. Some have relatives who probably have passed. In one organization, you might have hypochondriacs, as much as you might have people who are very reckless and will not wear their face mask, will not wash their hands. And you expect these people to cohabit the same office and work. I can bet you there are some people who, following the ease of their restrictions, have not made their way out of their rooms. They might only want to come out with hazmat suits or whatever. How do you convince this person to come to work and be productive? And that is where you need a psychologist in to speak with them. Again, for business continuity and for productivity, you need to plan for the worst, because COVID is one thing that can bring your organization on its knees. One person can have it and infect everybody. It can bring your business in terms of revenues and inflows to its knees. So how do you build a business continuity plan that is robust enough to survive the worst? Beyond running shift and all those things, what if in the next 6 months you cannot make revenue? What are you going to do? How are you going to survive? What if 80% of your staff get infected? How are you going to manage that? And these are thoughts that every business leader and organization should start thinking about. Again, you might also have to consider what employees would appreciate as good healthcare benefits. Who knows how much it will cost anybody to be on a ventilator for 1 week if the government is not paying for it? I don't think anybody knows. But it is possible. Again, if some of your critical staff have their families, their husbands, their children sick in the hospital, how much does it cost them? So that insurance that has only gone to the employee, that's about time it is extended to other members of their families as well. Now, for the sake of time, I also want to just speak about this and then we can take the questions. We had a lot of things about COVID and the risk, but then this is also an opportunity for businesses to reintroduce themselves, to relaunch, because in every crisis there are opportunities. This is about the time when they talk about pivoting and doing something else, which could actually be your breakthrough as a business. Now, you need to carefully look at what is going on, plan appropriately, and take the maximum benefit out of everything that is happening. There's this quote by John F. Kennedy which says that when crisis is written in Chinese, it is two characters. One is risk, the other is opportunity. So wherever there are these risks, there are business opportunities, and people will need to look at it carefully and take advantage of it. The other thing is that it is about time that businesses and leaders speak to the hearts of their staff. We talk about the cleaner. You may never have seen the cleaner. What will make the cleaner wear their uniforms and their caps in pride? It's about telling them in real quantities how many lives they have saved by cleaning that workspace. The dispatch rider, the remote delivery man, tell them in exact numbers how many lives they have saved by reducing the human-to-human contact. Let them wake up in the morning knowing that they are saving the world and they are saving your business. Now, when you put these practical things and human touch to the things that will bring your people back to work, I'm sure that you'll come out of COVID stronger than expecting that your business will come underwater post-COVID. For the sake of time, I'll leave it here, and I'm sure when we go into the question sections, we'll have a lot to talk about deeper. Thank you very much.
Okay, so we're going to go into our panel discussion, and you can send in your own questions. I think I would like to invite the speakers back to take your seats. Bonifacia, I think you could take this first seat, and Dr. Anderson, Dr. Alote, let's take the other seats. We're going to take a quick message, and then when we come back, we'll go straight into the conversation. You could be sending in your own questions and contributions using the hashtag safety at work, and we'll be taking all those comments in a moment after this message. Welcome back, and we're going straight into our panel discussion. We're going all the way to the top of the hour, where we hand over to the news team in the newsroom to bring us the midday news. So on the panel is Mr. Dr. Yes, Dr. Ernest Asiedu. He is the head of quality assurance at the Ministry of Health. And of course, our earlier speaker, Dr. Aloteado, is the medical director of New Crystal Health Services Limited. And Dr. Philip Anderson is a country manager for Roche Pharmaceutical. And Ms. Bonifacia Banafo Ejay, and she's the country manager for Safe Care Farm Access Ghana. So I'm going to start this conversation from the businesses have struggled, and some are still counting their losses in terms of the downtime that we had. Staff are also anxious to go back to work because in some cases either salaries were never paid for the periods that they weren't working, or their salaries were not in full. As we all try to go back to work to do what we enjoy doing and also be able to put food on the table, what would you say is the critical thing that those who are coming into work, now, employer has not made money. Are they able to put in these measures to ensure that the employees coming back are safe? Considering that the budget issues at play in this. I want to start with you, Dr. Ernest.
Thank you very much. So just to do a quick introduction, so my name is Ernest Kunedu Asiedu. I'm the head of Quality Management Unit at the Ministry of Health. And it's quite exciting to be here and to be part of this discussion. I would say that the ministry has supported the Ministry of Employment and Labor Relations, and then all the other labor relations organizations within the country to come up with kind of like a workplace guidelines as far as COVID-19 is concerned. And I think a portion of this is what Dr. Anderson touched on, as far as how staff or the employees, at the workplace are supposed to be managed to play their role in this COVID-19 era. Now for us, I think one big challenge has also been associated with the issue around stigma and discrimination, and that is what is quite critical in terms of how we can reintegrate people who test positive and then being integrated. And you alluded to the fact that when a person, has tested, or when a staff, tests positive, then it has a lot of implications, especially in terms of if they were supposed to be isolated and being treated, what comes out of that in terms of whether the staff are going to be remunerated. For us in the public sector, maybe me being a health worker, I'm sure we heard about what plans the President, His Excellency Nana Akufo-Addo, had put in place for health workers in terms of taking off the taxes and then also the 50% that is going to be added to salaries. But for private institutions, I know this can be quite challenging, especially if they need to produce something, and for which reason at the moment you are not producing. What becomes of how you're going to remunerate your staff and all that. So yes, really, I think it's obvious, and that has been a bit of a challenge in terms of how staff are going to be put back into the institution. Thank you.
Thank you. So, Dr. Anderson, the presentation preceding yours talked about the fact that it's not a one-size-fits-all approach to ensuring safety at work. How do organizations position themselves to offer that barrier of safety and awareness within the business, especially where you might have a few people who would have special needs, for example? So if you have hitherto a disabled person within, somebody living with disability within the organization pre-COVID, now you have new protocols. How do you make that all encompassing for people like that?
Yeah, thank you. So I think it all begins with knowing your employees and knowing them thoroughly. I mean, we know that people's health records are confidential, but they are confidential to the point where it saves you, or confidential to the point where it puts you at further risk. And so that's about time our human resource departments will need to make this clear, that the reason I want to know whether you are hypertensive or diabetic is not to sideline you or stigmatize you in any way, but it is so that I don't put you in a role or give you a task that will further put you at risk. So it is about knowing the people, and it's about now allowing the flexibility for these persons to work in a way that reduces the risk, including those who are above a certain age, because we know what COVID did to the elderly in many communities. So that's it. I think secondly, these things would come with some capital. You would need money to have more people or less people, bigger spaces, and all. And to the question you asked earlier, I guess this is also about the time that we need to talk about investments into businesses as we come back. And I think that is the spirit behind the stimulus package that the president has announced. I'm not too sure how it is going, but then we need to critically have conversations around us and what it means to sustaining our economies, including even conversations with our financial institutions. What kind of financial reliefs with good moratoriums can they give to businesses to come back? And maybe people should have a clear business plan justifying exactly how much they need to make sure that the workplace is safe for people to come back. And again, they've had enough to kick back their businesses. I think one other key thing that many organizations will face as we go back is the stigma of people who have declared their status and are coming back to work recovered. I mean, I was listening to your station this morning and listening to Gary Al Smith about what is going on at the UGMC. And for me, it sounds a little of a paradox or an irony, because the fact is, the people we should be embracing now are those who are recovered. Otherwise, we cannot be talking about convalescent plasma. They possibly would hold the keys to our survival, and they should be embraced. And so if we stigmatize these people and they stay away and we cannot take their plasma to treat other people, we are doing ourselves a lot more harm. They're actually jewels now. So organizations should also imbibe this pride in the people. Come out and say, I recovered, because you could probably be the solution to somebody living. And it is a way we can also look at the whole stigma thing and about these people being welcome back into the working space.
Okay. So, Dr. Alote, your organization, New Crystal Health, works with businesses and provide healthcare services for them. We often forget that Ghana is beyond Accra, Kumasi, and Takoradi. So the gaps between. What must be the approach for businesses that may have employees but do not have the structures that make them formal, like the banks and businesses like the Multimedia Group, but that these are people who may be a construction company that has workers coming in by day to work and earn a living? What are some of the things they ought to put in place to promote safety at work?
Thank you very much. In a way, you could say that COVID-19 is a blessing in disguise, because it has come to teach all of us that we've got to rethink the way we do things, and then the employees that we didn't think about before, now we've got to be thinking about them, which are the cleaners and those at the bottom line. Now, for us as New Crystal Services, just to buttress a point that was made much earlier before I get into the main point, it's important that businesses, like you said, once you have good relationships with your partners, i.e. the banks, the financial institutions, and this, you're trying to invest into COVID-19, into safety, into prevention, into sanitizers, into hand washing facilities, and things like that, which is why we have been able to secure, if you will, in excess of $5 million to put up new facilities and invest into our business and provide much better care to our existing clients and the new ones, and which will dovetail into what businesses will have to do to protect their workers. They will need to put in place. So we'll put up a safety, if you like, department, which is able to assist organization as we speak. So any organization that is willing and able to can contact us at any day, any time, and we are able to provide them those services. But more importantly, it is important that organizations invest into safety measures, into safety. I mean, in this part of our world, safety and healthcare has not been an issue, which is why coronavirus, if you will, is a blessing in disguise for us. So it has come to teach us that we look to invest into safety, and at New Crystal, we're taking the lead with that facility that we've secured, and to invest into the business and provide those services to businesses, to individuals as well. So I would suggest that, yes, businesses and construction and all of those things will have to take a very good look at investing into safety, employing, if you like, safety workers, to begin to put in place systems on safety to ensure the safety of their employees.
Right. So, Bonifacia, your mandate or what your organization does is to promote quality healthcare, and one that doesn't leave anyone behind. Extension of the by day, and I'm going to refer to an example from the fast-moving consumer goods segment of our business, where we started seeing sachet toothpaste, sachet oil. I mean, these are people who spend as they earn, and they spend in little bits. So healthcare is often relegated to the background until there's an emergency. How do you get people like that to start being proactive about being safe at work when that's never been at the front, top of their mind in terms of priority?
But thank you very much. I think that when we went on lockdown, some of us in our office and some circle of people that I often interact with, one of the group of people that we constantly thought of were the people that you have just described. We sometimes, maybe correctly or incorrectly, say that they are hand to mouth, or so they go get and then they feed on it. And so tomorrow, if they don't go, it's almost impossible. So those were the people that I felt suffered the most, even at the lockdown. And that brings us to the point that if you have gone through that, then you would have to appreciate that measures that we have been talking about, such as wearing gloves, such as sanitizing your hands, such as washing your hands, such as keeping your distance, is very essential to you, because you are also the type that if you are quarantined for 14 days, your children will not feed. And so this will be the message that I will pass to them, that because even for them in particular, they have to even take the preventive protocols even more serious, and also if they have, we live in a nation where we have a national health insurance also for us. Fortunately, this COVID treatment is also being taken care of by government, but even aside that, you also need to also invest in your health by getting yourself insured. It takes approximately 90 to 100 Ghana cedi for the whole year. So assuming this condition had not been taken care of by government, what would such people do if they had the condition? So it's time for everyone to think. I think when the new palang now is new normal. Everybody is saying it, even those who are less. Sometimes they say it in, they don't understand it. But if we are talking about new normal, then the new normal is thinking through the system to adjust your life so that in case something of that sort happens to you, what would you do? So for such a person, you should think about insuring your health or having a health insurance. You should also think about taking all the basic measures. Some of these things are very practical. In fact, when I started, I was just telling myself, this is only hand washing to take care of this. Only hand washing will take care of this. But then we are struggling. Why? Because we neglect basic things. So it is important for such people to take those basic things which comes very cheap, such as hand washing. So now face masks, you can have the cloth one, such you can cover yourself. You can, while selling, you could still sell your things to the person by arm stretch and keep your distance. So take care of yourself, because you are the one that suffers even more if you happen to get the infection. That's what I'll tell them.
Okay. So, Dr. Konode Siedu, in terms of data, and if you look back the world over since this fight started, data has played a critical role in how policies are formulated. But health data especially is very fragmented. If I went to a hospital on my way to Tamale and I was unwell and stopped at a hospital, my health records sit there. But the decisions that will be taken today if I present with COVID-19 will be dependent on my overall health history, which is I may not remember, but I will have a key in there. Going forward, what do you think ought to be done or should be done to ensure that the best information is available to the clinicians and everybody who has to deal with somebody who has COVID-19?
Yeah, thank you. So I would say that the ministry has adopted the electronic medical record system that is integrating both public and private sector into it. Of course, I would say we are not there yet. And this, initially, we have the District Health Information Management System, which is more unaggregated data. I think what you are talking about is more the individual data that I would say is not widespread in the country. But if you go to some regions like Central Region, for example, we've deployed the electronic medical record system that is interoperable. And so it's possible that you can migrate it from one facility into another facility for you to know what the situation is. And so this is the direction that the ministry has adopted. And then moving forward, that will help us to move data from one facility to another facility. And for which reason, if I'm doing a referral and it's an electronic referral, then the other facility would know exactly the information that is available. But just to mention something about what Dr. Anderson talked about, you know, yesterday I was on Standpoint, and that was the first time that I, let's say on media, mentioned that yes, I tested positive for COVID-19. And Gifty said, wow, and you know, you never told me. But during the time that we were doing the national mandatory quarantine, you know, the 2-week period, and then the country lockdown, you know, I was coordinating the quarantine work, you know, in the hotels in Accra. And then in the 3rd week, we were supposed to do the contact tracing during the period that the lockdown was in place. And so at the end of it, I had come in contact with more than 100 positive patients. So I considered myself as a contact. And so I said, okay, willingly, I would test. At the time, I didn't have any symptoms. And then when I tested on the 10th, on the 17th, I got a call that they've seen my name among the positives. Okay. I found myself at the time taking care of the positives, you know, in an isolation center. So I stayed with them and then became also isolated in the same place. And then my colleagues who were there taking care of us, you know, at the same place. And so I think just to say that there is no mystery. I keep saying this, and the last few days that I came back to the ministry, I was telling colleagues that there's no mystery around testing positive and then also recovering. But I know that there's some stigma and discrimination around. In fact, after I have mentioned this, from time to time, people say, hey, you know, when I say that, oh, have you really come in contact with somebody who has tested positive before? And people say, no. What about person tested positive and recovered? They say no. I said, but I'm standing in front of you. They take 2 steps back and look at me again. You know, so clearly, I would say that the issue around the stigma, you know, discrimination at the workplace is quite strong. And the more we talk about it, and then the more people see, the better it is for all of us, because really, I personally don't see anything wild about it. Of course, it's important that we adhere to the protocols like using the nose mask, and even as we are distant, everybody is still wearing the nose mask, keeping our distance, and then also hand washing regularly. I think that is something that if we all do, is going to go a long way. But then again, what is important is the opportunity to share from time to time for people. I'm sure Alex and then Philip are hearing this for the first time, and they're, wow, this guy is sitting here. But I got a bit scared earlier on because one of our senior colleagues, you know, passed on from this. Of course, he was not a frontline, you know, person at the time, but it put a little bit of fear in me that, hey, really, the thing is real. It can kill, because I could put a face to the data, you know, at the time. But when I tested positive, I mean, I went through, tested a number of times, it became negative, and I've recovered. And I continue to do what I need to do. Strangely enough, as soon as I recovered, I went straight to the Pentecost Convention Center. And people said, but this guy, is he crazy? what is he going to do there? To continue to offer my service. And then from there, I came to the Ghanaman Soccer Center of Excellence because we got our Kuwaiti returnees there. And just 2 weeks ago, we finished. And then this week, I'm still there, still taking care of our own brothers and sisters who return from Benin. Usually, French students who go and do 1 year out, So I came back from there 2 days ago to come and support some work in the ministry, and then I'm sitting here. So I'm just trying to let everybody know that when you test positive, and then you go through whatever treatment, being isolated to minimize the spread to other people, you take care of yourself well. You test negative, and then you recover, and you are like any other person, reintegrated into the workspace, and you continue to do what you are supposed to do.
Wonderful. I mean, we have very limited time. We will be ending this in about 4 minutes, so I'm going to start from Bonifacia. I think I will take your final thoughts in 30 seconds, if we can do that.
All right. So, as much as possible, all of us should, as Dr. has said, the infection is real, but it's preventable. We can prevent it and work with it. Let us establish infection prevention protocols in our workplace. Let's adhere to them. Let managers and leaders monitor adherence, and in the case of infection, let us follow the necessary protocol to isolate those who are infected so that work can go on. Leaders should be inspirational enough and motivate people, talk to people so that they pick up their morale and their anxiety level goes down, so that we can all work in the environment to bring the whole economy up, not only individual business, but then the entire economy. That's what I would like to say.
All right. Well, thanks very much. Dr. Anderson?
Right. So I would say that as we all look for how we come back in terms of financial investment, business leaders should look at the opportunities that COVID provides. And I think there's a lot more investment in there than what the government can give you. We should treat our employees humanely and with a lot of empathy. I mean, addressing their needs specifically as persons and not blanket organizational structures in returning to work.
Right. Dr. Alote.
Sure. Thank you very much. So, everybody has said COVID is real. As a business opportunity, New Crystal Health Services, we take advantage, not in the negative sense, but in the positive sense. So very soon when Anderson's company has introduced the antibody testing there, it will be available at New Crystal Services Limited for us to have those tests done. And of course, that huge money, unprecedented in this country, what else can you expect than much better care? Yeah.
That's right. Okay. Finally, Dr. Konedu Sedu.
Thank you. So I think all my colleagues have mentioned COVID-19 is real. We all need to work towards preventing it. But I think it's also created some opportunities for Ghanaians to be very innovative. You can see the kind of nose mask and that the one that you are wearing are all locally made. A lot more people have been able to do things. Most of the PPEs that we currently use in the health sector are made locally. So that is a business opportunity for people and then for the country to minimize importation. The last bit that I just want to talk about is related to the stigma and the discrimination at the workplace. When people
may I interject for a second? You can make that, but there's a question which I think you can answer, and it's come from our Zoom participants. So in the electronic medical system, what efforts have been made for privacy and data protection to be enhanced?
So thank you very much. So for example, at the moment, we have what we call the SORMAS, and that is helping us to input the data for every person who would want to test either positive or negative. But then access is given to specific people, So for example, I have a national observer status that I can look at the data and see how we can assign people to do. And then most of the people who input the data are also people who can have access to their specific district to make those data available. But I think there's also a Data Protection Act, and every health worker, be you a clinical or a non-clinical person, has been trained to know that every data that we have within the health sector is privileged information, and you don't have to abuse giving information to people.
Okay, so now you have 10 seconds to make your final point.
So the last bit just to add is about stigma and discrimination. And I think that at the workplace, when people test positive and ultimately test negative, the institution should be able to reintegrate them and then also to educate the rest of the staff that they are no longer infectious and should be able to do what they need to do. Thank you.
Okay. Well, thank you very much, doctors and Ms. Beneficia, and thank you for joining us. It's time for us to go back to the studio for news at 12, both on radio and on television. The COVID-19 Safety at Work webinar and forum has been brought to you by New Crystal Health Services Limited. They have across the country, in Accra, in Ashaiman, in the Western region. Do get in touch with them if you need some further explanation on what to do, and also supported by Farmer Access. And thank you to our speakers, and thank you to everyone who's made this possible. Until the next time, be safe, keep washing your hands, socially distance, and also ensure that you're wearing your face mask, or rather nose mask. Thank you. Go forward, make rain. Shalom.